My name is Neil Franklin. I'm the Executive Director for the Law Enforcement Action Partnership. Again, thank you for attending this exciting webinar. If you have any questions for the panelists, they can be emailed to Amos. Amos is the one who sent you the calendar invite, or you can send a private chat message to Amos. And I believe Amos also put his email address in the chat box, so you can use either one. So let's get right to it. And I'm going to introduce our moderator for today. That will be Chief Tom Synan. Chief Synan is of the Newtown Police Department in Ohio. So Chief, I'm gonna let you take it away. And thanks again for moderating this important panel discussion for us today.
No problem. Thanks for having me, Neil. Again, my name's Tom Synan. I'm the police chief for the village of Newtown, just outside of Cincinnati, Ohio. And I'm also one of the co-chairs for the Hamilton County Addiction Response Coalition. Thank you all for joining this. It's obviously going to be a very fascinating and insightful conversation talking about overdose prevention sites. And we're going to hear from experienced law enforcement officers, and they're going to share their stories of the pros and cons are some of the challenges they've seen with these overdose prevention sites. To explain a little bit of the structure, we have a series of questions lined up to get the conversation started, to get a little bit better understanding of what the overdose prevention sites are. And we're hoping that we stay on track with time, because obviously this is a topic that generates a lot of discussion and questions. So we would love to leave some time at the end to get your guys' input, all those of you watching, get your questions answered. So we'll try to make sure we stay on time to get that done. I want to introduce this incredible panel. I'm really excited to hear from what these officers have to say about their experiences. And I want to first introduce Inspector Bill Spearn from the Vancouver Police Department in Canada. Bill, thanks for joining us.
Morning, Chief. Thanks for having me. Pleasure to be here.
I want to also introduce Staff Sergeant Conor King from the Victoria Police Department in Canada. Conor, good seeing you. Thanks for being part of this.
Thanks so much, Chief. Happy to be here.
And then I want to introduce Superintendent Henrik Oryé from the Copenhagen Police Department in Denmark. Hey, good to see you again, Henrik. Got you on mute there, Henrik. Got you on mute there. There we go.
Good.
There you are.
Oh, yeah.
Twisting around, but we got you. Doing good, Henrik?
Thank you very much for being here. Thank you.
No, thanks for being part of this. Hey, we're going to assume that the folks on here on this webinar understand the overdose crisis we're experiencing, not just here in the United States, but around the world. I am a chief of a small community. It's impacted me like everyone else. I've seen an entire family, a mother and all three of her sons die from addiction, and we deal with the third generation. This is not unique to Ohio, to the United States, or the world. So with the understanding of the overdose crisis, we're not going to go back and talk about the history of the overdose prevention sites. We want to hear from these law enforcement officials what's happening present day. What do they experience right now? So I want to start by asking, I'm going to ask Conor to start it off, but I want Bill and Henrik to give their input on this first part, because we have to have an understanding. First of all, what type of overdose prevention sites do you have in your community? And can you give us just a brief mental picture of how they work? Conor, you mind getting us started?
Sure, Chief. Thanks very much. So the city that I work in, it's Victoria, British Columbia, and we're a population of about 85,000. So you can keep that in mind as you compare Bill Spearn's stories with Vancouver, with a population, I think, nearly 1 million. So we're about 85,000 people. We have a downtown core that does have some issues with open air drug use and drug dealing, etc. So we started with 4 overdose prevention sites in 2016. One of those was what I would call a storefront site, which means that anybody from the community can walk into that site and they can use drugs that they bring in under supervision of medically trained staff. Then we had 3 other sites which were inside supportive housing units. And basically that's, I guess, what you would call a homeless shelter in some vernacular. And those sites were designed for the use of the people inside the shelters. Because what we were seeing was people were coming out of the homeless shelters if they didn't have their own room particularly, and they were using drugs in public spaces, alleyways, doorways, gas station bathrooms, 7-Eleven, etc. So this put the overdose prevention site basically generally the right inside the front doors of the supportive housing unit, and that allows for use solely by the people who live in that facility. But fast forward to 2020, and now we have 7 sites now in our city, 2 of which are storefront, and then 5 are inside the supportive housing.
And hey, Conor, just real quick, I think you and I have talked before. Don't you have a site that is literally almost basically in front of one of the police departments?
Yeah, so yes, we do. We have a site that is shares the parking lot of the Victoria Police Department headquarters. What happened was they had converted a hockey rink. So how very Canadian is that? They had converted a hockey rink into a homeless shelter as part of the pandemic response, and they created a overdose prevention site directly inside the arena, and outside of it, there's some pictures there if you can see them. So that's inside the arena. That was designed to provide for social distancing, and that shares the parking lot with the police department. And then if you can see, if we have the photo from outside, I'm not sure if Amos has that or not. Outside, you would see that the front doors of the shelter. No, that's Insight over in Vancouver, Amos. In any event, we share. There's the inside of the arena where they put in the bays for consumption. And so I took this photograph myself from the 2nd floor of the Victoria Police headquarters, and that white arrow points to the overdose prevention site, and that is the outdoor safe inhalation component. So people will sit there and use methamphetamine or heroin or fentanyl or whatever it is they've brought with them, and that's directly across the parking lot from the police department. We have virtually 0 issues with this place. We thought we would, and we have 0 issues. So it's actually, I consider this probably our finest success when it comes to working with overdose prevention sites.
Yeah, I told you this conversation would be interesting. There you go. Hey, Bill, can you give us a brief mental picture of what you guys, what your sites look like out there?
Yeah, sure. So Vancouver is the largest city in British Columbia. We have a population of around 645,000 in about 55 square miles, or what is that, 135 square kilometers. So in Vancouver, I'll go through this kind of depending on what site I'm talking about, but we have 9 needle exchanges, and those have been around since about 1999, 2000. We have 3 supervised consumption sites, and those are sites that operate under a federal exemption that allows people to bring in street drugs and use them inside the facility. This is a picture. This is a picture of Insight. So there are 13 injection booths. Insight is a storefront. It's in the 100 East Hastings, the poorest area, or the poorest postal code in Canada, an area of high crime and drug use. Has always been like that before Insight was there. People come into Insight, they go into a reception area through the front door there, you can see. And from there, they go inside to an injection booth where they either inject or orally use their substance. And then they go into what's called a chill room. So we're not just throwing them back out on the street, where they have a chance to use or have a drink of water, something to eat. It's staffed by peers, and then they go back out onto the street when they're ready. So we have 3 supervised consumption sites. Insight is the most famous. It was North America's first supervised injection site, operating under an exemption back to 2003. We have 2 other sites. The second one is called the Dr. Peters Center, which is a site that's inside a clinic for HIV and AIDS patients. It's actually been open since 1999, 2000. It was pre-Insight. We always knew it was there, but I have to say that a majority of citizens in Vancouver still don't know it exists. No issues with it whatsoever. And then the third site opened, I think, in 2017, 2018, Powell Street Getaway. So those are our 3 supervised consumption sites. That's what we call them here. We also have about 10 overdose prevention sites. I think sometimes people in the US refer to these as guerrilla sites, but we call them pop-up sites here. And what they are is they're sites that are supported by our local health authority. They can be something as simple as a tent. I know that Amos had a photograph of probably the first overdose prevention site in Vancouver, which was a picture of a tent in the unit block of East Hastings Street. And when that popped up, I think in 2015, 2016, the way that we treated that was that's a healthcare facility. That's a healthcare issue. It's not a law enforcement issue. It's saving lives, and we left it alone. So we have 10 overdose prevention sites. They can be something as simple as this to a van. We have a mobile van that travels around the city as well and goes to hotspot areas. And then we also have what we call witnessing rooms. So in social housing units throughout the city, they all have, there's at least 25 of them that have what we call witnessing rooms. And these rooms are rooms where people can go use their drugs. They're either staffed by a peer, a person who uses drugs to witness their colleague, their friend, their neighbor using drugs, or they have CCTV where they're monitored at the front desk. These places have naloxone and they're able to respond because 80% of our overdose deaths still occur when people are using alone. So that's kind of, those are the sites we have in Vancouver, quite a few, been around since, around 2000, 2003, and continue up to this day.
Yeah, thanks for that, Bill. That's extensive. Hey, Henrik, can you give us just a brief overview of the mental picture of what you guys have out there in Denmark?
Yes, of course. In Denmark, we have 5 drug consumption rooms. 3 of them are in central Copenhagen. We are at a population of 5 million people in Denmark, 1 million in Copenhagen. The first drug was an old ambulance bought by NGOs, and then it started around that in 2012. And now we have 3 drug consumption rooms. They're open 24/7, and most of them are divided in 2, one for injectors and one for smokers. And one of the police station.
Technology. I think we still got you there, Henrik, or did we lose you? There you are. Can you just give that last part again, please? I heard the police station.
Yeah, one of them is around 300 feet from the biggest police station in the Copenhagen. Yes.
I find that fascinating, and it is so cool to hear from the law enforcement side about that. Hey, let me ask another question in law enforcement related. What changed for the police when these sites came in? Bill, can you give us some kind of idea of what changed for you all?
Well, thanks, Chief. I can say that I can't emphasize enough that the most important thing about these sites is location. You have to put them where the issue is. And in Vancouver, Insight, which is also just around the corner from one of our police stations, has been there since 2003. And like I said, it was placed in an area that already had a lot of crime. It was placed in an area that already had a lot of drug dealing, drug use going on. And so really not that much changed for us. I have to say that, I'm part of a shrinking demographic in the Vancouver Police Department that's worked pre-harm reduction and post-harm reduction. Most of the members working for this police department now don't know of Vancouver without harm reduction sites like Insight, needle injection rooms, that sort of thing. And they walk by them, we don't even see them. Like, we have bigger problems in Vancouver than these sites.
So let me follow up with that real quick, Bill, because that's kind of fascinating. So are you still responding to overdose calls, or has this kind of taken that over and the law enforcement is focusing on other issues? Is that the way you would look at it?
Well, up until 2006, the police did respond in Vancouver to overdose calls. In 2006, we changed our policy that we do not respond to non-fatal overdoses. We only respond to fatal overdose calls. And the reason for that is we want people to call 911 and report these if they're overdosing or somebody they're with is overdosing without fear of repercussion from the police. And if we do attend these, it's only for public safety. It's not to arrest people.
Huh. And you're really good making my job easy, Bill, because you segued right into another question, and it was perfect. And, you know, some U.S. cities are considering overdose prevention sites, but they're seeing some objections about where exactly to put them and what effect that might have on local neighborhoods. You always hear about, I don't want this in my backyard, and there's a lot of preconceived ideas, a lot of rumors, a lot of fears. So, hey, Conor, let me ask you, what advice would you have for a U.S. city that might be considering this? Where would you recommend putting it? I'm kind of fascinated to hear that it's got to go in a location where it's needed, but also here's some locations right by police departments. That kind of floors me.
Yeah, thanks, Chief. That is a great question. And of course, that's the age-old debate as to where to put these sites. I will echo Bill's comments that really we led the discussion with where are the sites needed? What is needed by the community, and let's put the sites where they're needed. And generally, those are in places where you have that already existing level of drug use and to some extent the collateral effects of open air drug use. So we put the sites in those locations. There is no point, in my experience, putting a site that becomes unused. You have just wasted a whole lot of resources. So clearly, we weren't putting sites out in suburban shopping malls. We're putting them in the places where they're going to meet the needs of the people that are basically, these sites they're only one tool in the toolbox, and they're designed to assist essentially the poorly housed or marginalized people in your community who have nowhere else to go. But when we put the sites in those locations, what we saw was less open air drug use. And when we put the sites, that was particularly the case with the storefront site. And then when we put the sites inside the supportive housing units, we saw less overdoses in the various individual rooms inside the homeless shelter. So really, we feel good about where the sites were located, but it is really important to accept the input from all members of the community. So we did a lot of consultation, working with the health authority together with neighborhood associations and business associations. And very interestingly, what we have found is that business associations, particularly in the years since, have come to say we're supportive of these sites because now we see less disorder and less open air drug use in the neighborhoods around. And it gives the police officers, really importantly, somewhere to tell people if they're using drugs on the street, we say to them, hey, go to the overdose prevention site. It's a half a block away. Make the effort to get there. And it empowers our officers with another tool to direct people into a healthier drug use.
Well, Conor, that segues perfectly to the next question. And Henrik, if you don't mind spearheading this one, and you were just talking about it, Conor, I know this is brought up an awful lot. One of the concerns people have is that if you have these overdose prevention sites, you're going to be having people selling drugs outside of them. Has that been your experience, Henrik? Have you seen that there with your sites?
No, it's not my experience. Of course, there could be some few cases with it, but no. In Denmark, Copenhagen, there also was a lot of discussion around residents. It's close to schools and kindergartens and whatever. But now they can see the benefits. The residents can see they're not in front of the front door and they're not in the basement, and the shop owners also get a benefit. It's more quiet. So, and the buying and selling is not.
Oh man, Henrik, you still with us?
Henrik, it might help to turn off your video, which I can.
We're getting you spotty there, Henrik. Are you back? Okay.
Henrik, I'm going to stop your video and see if that helps at all.
Okay, we'll keep working on that, but I'm going to open this up to all of you, and I'll start with Bill, if you wouldn't mind spearheading this one, and I'll get it to everybody. So one of the big questions, especially from a law enforcement perspective, Are police supportive of these sites? What do you experience with the officers on your department, Bill? And it's kind of fascinating. You talked about you got a new generation that's coming in that hasn't seen it before. Are they buying into this?
Yeah, absolutely. I mean, I think that, we want to be compassionate. We believe the Canadian Association of Chiefs of Police believes 100% that this is a healthcare issue. We support things like supervised consumption. It's part of the puzzle. Our officers are very supportive of these initiatives. The alternative is, the spread of bloodborne diseases, more overdoses, sickness, marginalizing people further. If it wasn't for these sites, we would be picking up a lot more bodies, let me tell you. It's bad enough here. It's one a day right now in Vancouver, or more. A few weeks ago, we had 14 overdose deaths, but I would hate to imagine what the situation would be like without these sites. I can say that my chief supports it, our membership supports it, our National Association of Police Chiefs supports this. So, supports supervised consumption, supports safe supply, and even decriminalization of personal possession. So those are, we've come a long way in 10 years.
Yeah. Hey, Conor, what's your experience with your fellow officers? Are they buying into this?
Yes, indeed, Chief. I would say really what happened, I think, in the British Columbia experience is that through 2015 and 2016, just the sheer number of overdose deaths changed people's minds. And as Bill said, we're fortunate here because police really see this as a health issue. This is not, drug use and addiction is not in the Canadian lens, a law enforcement issue. It's a health issue. And so when health authorities and the provincial and federal government told the public and the police and all the stakeholders that we're going to open up these overdose prevention sites, I think many in the policing community said, the decision has been made. Let's get on board and support them and make them work. So then it becomes a question of how do you throw your support behind them? And in fact, we had at the Victoria Police and Vancouver and the Royal Canadian Mounted Police to some extent has strong relationships with the British Columbia Centre for Disease Control. And because we had these strong relationships, they actually reached out to us. And I was one of the officers that helped create what's called the Overdose Prevention Service Guide, which is a guide that the overdose prevention sites need to employ to open up their individual sites. And the guide provides a framework for working with the community and working with law enforcement. So for us, the solution was to get deeply involved in the creation of these sites so that we have a voice and we can guide it, so that public safety is part of the equation, but public health is part of it as well. So the two philosophies work together.
Well, you just gave me a question at the end I'm going to be able to ask because of what you just said there. So I appreciate that. Hey, Henrik, do we got you back?
I'm back. I think I have a better connection now. Yeah.
Yeah, you sound great.
Good.
What has been your experience with your officers since you've had these sites in? Is it a positive, or do you have some officers that are struggling with this?
I think today definitely positive. Of course, in the beginning they were not so positive, but now I don't think we won't go back, if we could say in that way. Then it's clear.
Fantastic. Hey, Bill, I want to ask a question of you because I heard you say this. It's something I'm not very familiar with, but I kind of, at least conceptually, kind of understand where this is going. But you mentioned safe supply, and especially with fentanyl being such a staple in the worldwide drug supply, obviously it is causing much of the overdoses. Is that what safe supply is about? Is it a way to kind of counter that? Can you give us tell us a little bit about what is safe supply?
Well, just to dumb it down, I guess safe supply is giving people the drug that they need in order to help them with their addiction. And what we do now is we open up these. So all of our supervised consumption sites were the concept that we use now was developed pre-opioid crisis. And so where we allow people to bring in street drugs. Well, now we know the supply is contaminated And we're still operating under that model where we're saying, hey, here's a place that you can bring your drugs and inject them safely under supervision. But we want you to go out on the street and buy poison and bring it inside. So what the police are saying now in Canada is that we support something called safe supply, which is let's give them a prescribed medical alternative to these toxic street drugs so that they're not overdosing and dying. And that, that gives us that, that gives healthcare that, gets these people on board so that they can be monitored and that sort of thing. So there's no reason, if we know that, if bread was, poisoned at the store, we wouldn't tell people to keep going and buying it, right? We come out with some sort of alternative. Right.
Hey, thanks for that. And viewers, hey, keep bringing your question in. Amos has got me a whole list of questions, and we'll get those at the end. So please keep bringing those questions in. I'm going to tell you they're fantastic questions, and that's why it was so important to get your input. So, Conor and Henrik, let me ask you this. This is from a law enforcement perspective. Okay, we're cops. We're supposed to be protecting and serving. We're supposed to be enforcing the law. If we have one of these overdose prevention sites in our community, the question is, are we turning a blind eye? Are we enabling people to use these sites and enabling addiction and enabling some of this? What has been your experience from your officers? Do they struggle with that? Conor?
Thanks, Chief. Yeah, I mean, that question is really kind of specific to every different jurisdiction because the laws are different in different states, I'm sure, and in different nations. But here in Canada, we have an enormous advantage, and that is that this has been settled in law. In 2011, the Supreme Court of Canada ruled unanimously, 9 justices, and of course, I think it's fair to say that a unanimous ruling is pretty rare, but 9 Supreme Court justices in Canada ruled that Insight in Vancouver could not be closed by the federal government because it was saving people's lives, and that people had a constitutional right to healthcare, and that Insight was a healthcare facility. That set the stage by which all the decisions have flowed since, which is that these sites that drug use at these sites is exempt under the Controlled Drug and Substance Act, and therefore is not actually illegal. That really helps police in their decision making because, and believe me, there are still some police who struggle with that. They want to grip their regular duties, which is to arrest people who have drugs in their pockets. But what we tell them is when drugs are being used in these sites, it is actually not illegal, and it is a health issue, and we step aside and let the health professionals do their part. For different jurisdictions, that's going to be trickier. But part of your question, Chief, was, are we enabling addiction? And I personally look at it, and I think the philosophy that police have adopted here in Canada is that police don't have a role to play in addiction. We are not the police of addictive behaviors. Addictive behaviors are something that is being tackled by health professionals. People are on their individual journeys at their individual paces to tackle with addiction. And as far as if you're going to believe that the opioid crisis is a health crisis, then let health deal with the addiction component.
That's incredible. First of all, that 9 people agreed on something. Sometimes one person to agree. So that's incredible. And I didn't know that was a law. So I guess that does make it a little bit easier for you guys. Henrik, what's your experience with your law enforcement officers? Do they feel like they are enabling people when they're around these overdose prevention sites?
In the beginning, when things were going to change, yes, we had to change the mindset. But I could tell them, when I was a very young police officer, I was working in that area. It was hard work. We were busy. We did our very best. 20 years later, I became a commander of that area. And as I told my police officers, you are working as hard as I did and whatever, but nothing has changed. It's not getting better. So something else has to be done. And we have to be supportive to new initiatives and see what's happening. Otherwise, we will continue and not for the best. So, of course, and now I think I can say most of the don't want to go back. We see it's better now.
Yeah, that's great. Hey, Bill, I want to come back to something that I heard you mention, and I'm not too familiar with this, but you mentioned something about some like unauthorized or not legally authorized overdose prevention sites. And I guess there's other places in the world that have dealt with this, and some authorities have even come out and said, look, we're not going to enforce this. The police are kind of in support of it. But is that your experience with some of the sites there? And how did you maneuver through that? It's not necessarily legal or authorized by the government, but it's going on. How'd you deal with underground sites? Did you have some of those?
Yeah, we call it like, I think I called them pop-up sites.
Yeah.
Here, I know that you guys sometimes refer to them as guerrilla sites, but yeah, we believe that it's not a law enforcement issue to deal with these pop-up sites. We've had them, we still have them popping up in Vancouver, and we believe that they're the purview of healthcare, that it's a healthcare issue. And usually what happens when these things appear is that the healthcare authority will go in and make sure they have things like naloxone, oxygen, harm reduction supplies so that people can use clean supplies. And, you know, they move in and take that, that's their purview. That's a healthcare issue. It's not a law enforcement issue. If we go in there and shut these places down, people are going to go use alone in their residences, in alleys, and they're going to die as a result of it. So, you know, we look at it as that they're saving lives.
Yeah, that's fantastic. Hey, Henrik, let me ask you this question. What else is happening locally that helps improve the relationship between public safety and overdose prevention sites? What are you doing as law enforcement that is working with them and developing that relationship? Because I'm guessing it's got to be a two-way street. Even if law enforcement's not taking the lead on it, there's still that public safety component. So what are you guys doing to foster that relationship?
It's a long term. We worked together for many years, and now we are beginning to, after some years, we're beginning to trust each other and making good relationship, and can have some informal talks also. As I think most police officers know, wherever it is in the world, we get a lot of complaints. Most of them we don't feel it's not so good. And but if we can talk instead of writing, then we find out how can we help the other ones and the NGOs and whatever, and they can also help us. What can we do? We can provide safe areas and increase patrolling in some districts or whatever, if it's necessary, and they can give some messages to the residents there, and as we can't give them. So it works both ways.
Yeah, it sounds like if you have that trust, then the community can trust in what you're doing along with the overdose prevention sites. So it sounds like it goes both ways. Hey, Conor, let me ask you this, and I'll probably open this up to all of you, but let me ask you this, is what challenges are you still facing with addiction and overdose? Because, you know, Conor, you and I talked once before, and you brought up a really interesting point, is that this is not the cure. This is a tool, and there's still challenges. So what are some of the challenges you're facing?
Well, thanks, Chief, again. I think the single biggest challenge we face is that, and I see a lot of questions that are talking about this, about the concept of testing for fentanyl. So the single biggest challenge we face is that the drug supply, the illicit drug supply, is completely saturated with highly toxic fentanyl. And we have drug checking at some overdose prevention sites in British Columbia. And what it reveals time and time again is the presence of very dangerous levels of fentanyl and fentanyl analogs and novel substances with incredibly complex names. And people are still choosing to use these substances despite the fact that they are testing positive. And what this means is people are dying at still really, really terrible numbers, despite some of the things we've implemented. So the challenge that we're really tackling here next, and Bill has alluded to this, is it's a kind of a terrible concept that we've got overdose prevention sites and supervised consumption sites, and we're telling people, bring your garbage drugs to our safe site and use them here. And then if you overdose, you'll be, we'll be able to reverse the overdose. And what we're saying now is, how about if people have access to a safer supply. And these are the right people who are just not right now able to stop using drugs, and they have tried and tried and tried different methods, and that's not where they're at in life. What safer supply can they access? And so that's what British Columbia has rolled out over the last few months, particularly with the use of hydromorphone or Dilaudid, widely available now via a prescription from a physician. But it's not perfect either. Many people don't want to use hydromorphone. They want to use heroin, and the health community is grappling with how to access a safe supply and how to roll it out effectively. So overdose prevention sites are just one tool in the tool shed. There's lots more to it for sure, Chief.
Yeah, Conor, you bring up a good point. And as a law enforcement officer working both on the supply chain and addiction, fentanyl ends up being, I tell people, whatever's happening on the street with the fentanyl supply is going to dictate the overdoses. And it's one of the things that makes it so challenging. We have fentanyl test strips and still overdoses are high. So you bring up a really good point. Hey, let me ask one more question for the group, and then we'll get into it looks like we're doing good on time. We'll get into the questions from the viewers because there is a stack of really good questions. So let me finish up on my end with this question, and let me go with you first, Bill. What benefits are you seeing? Is the community seeing with the overdose prevention sites?
Well, I think the biggest difference that the community is seeing is fewer overdoses and especially fewer deaths. For me, you can't quantify that enough. If it wasn't for these sites, people would be using alone and people would be dying in greater numbers. That's the biggest difference by far.
Yeah. Hey, Henrik, what do you think is one of the biggest benefits your community is seeing from the sites?
The same as before, but also more peace and quiet in the neighborhood, and more focus on other police tasks and dignity to the users in our area, and concern and care, and also provided by the police.
Conor?
Yes, Chief, thanks. What I wanted to mention when you asked this question is that there is actually a University of British Columbia study that came out a couple of years ago, and they looked at 18-month period between 2016 and 2017, and they did something called mathematical modeling. And I'd never heard of mathematical modeling when I read the study, but now it's become more a commonplace term when we look at COVID-19 deaths. But they did a mathematical modeling study of what benefit have overdose prevention sites created for the community, and they determined that about 230 deaths were averted in 18 months because of 23 sites across the province. So when you look at just the science behind the efficacy of these sites, 230 people are alive because of them. So for me, in law enforcement, the single most paramount mission that police officers have is saving people's lives. And if we can be part of saving people's lives through that fashion, then I'm all for it.
Well, that was fantastically said. Very appreciative you said that. Hey, let me ask you one more question. This came out of my head when you guys were talking. Is it fair to say that you and law enforcement in your jurisdictions are looking at addiction as a health issue? That's the priority, is that it's a health issue before it's necessarily a criminal justice issue. Is that fair to say, Henrik?
It's very fair to say. I agree.
Conor?
Yes, Chief, that is again the absolute number one way we view the opioid or overdose crisis is it is a health crisis, and the police have a supportive role to play, but it is a health crisis, and all decisions flow from that decision. How can people get the health care that they need in this situation?
Bill, fair to say?
Yeah, absolutely. I want to echo what my fellow panelists have said. I agree with them 100%. And I just want to add one thing, that we are criminalizing this medical issue, and yet others we are not. People have many sorts of medical issues, and we don't criminalize them for that. Why are we doing it here?
That's fantastic. And it looks like we did really good. It looks like we're on the mark for time. So this is fantastic. And Amos, we good to get into some of the questions from, okay, fantastic. I actually had someone a friend of mine texted me yesterday and wanted to ask this question, and it's kind of talking about the health realm. They're with the emergency medical services, the EMS locally, and they're part of the coalition. We've been working with EMS and law enforcement. Is your EMS, your paramedics, your first responders on that side, do they work closely with you, and do they work closely with the overdose prevention sites? Conor?
Yes, Chief, they do. They've been at the table right from the beginning with the implementation of the sites, and in fact, they were providing some staff at some of the sites. But really, what the sites hoped to do in many ways was take the pressure off the paramedics, because they're driving around our city going from call to call, and this frees them up to actually respond to the heart attacks and the car accidents, and reduces the number of overdoses that they're going to. So they were really in favor of the sites for that ancillary benefit as well.
Yeah, fantastic. Hey, now we're going to get into the questions. Keep popping them in. I mean, Amos has got me a whole list of texts that I'm going to be going through here. So first of all, thanks for being part of this conversation. And like we said, this is going to generate a lot of discussions, a lot of questions. So let me start off with a question from one of the viewers here, and it's from a police officer, and he or she wants to know, how do we get buy-in from not only the community, but specifically from frontline officers in a patrol capacity? Bill, do you have thoughts on that?
Yeah, okay. I think it's important that you have buy-in from your leadership first, from your executive members, and it makes it much easier for the frontline members, most of whom I would probably say already believe that our drug policy is broken, and the way that we conduct ourselves is not appropriate when it comes to addictions. So I think I think we all believe that, probably.
Who would you like to FaceTime with?
Technology.
Okay, sorry. I'll just say that I think, or I am of the belief that nobody has ever been helped with their addiction issue by being thrown in jail. And I think that's something that's pretty straightforward, that we in law enforcement, at least in Vancouver, believe. But it can take years to get buy-in from your members, but it really helps if your executive is on board with you as well.
Yeah, Henrik, what about you? What's your advice for getting buy-in, not just from the community, but specifically from the frontline officers, the patrol officers? You were talking yesterday about being a young officer on the street and doing drug work. How do you get buy-in from the fellow officers?
I think everyone should have the right to speak and say whatever they want. Also, all the police officers, everybody should be heard. Some is pro and some is against, and free discussions. Say what the police officers feel, and let's talk about it over the coffee. And then also senior police officers with a cup of coffee say, I've been doing your job for 20 years ago or whatever. We have to change. So free speech.
Hey, Conor, you got some advice for that officer?
I think Bill was on the right track there. We a couple of years ago here in British Columbia, we had basically a leadership meeting in Vancouver where we brought in the chiefs of police for the various departments and the heads of the RCMP detachments, Royal Canadian Mounted Police detachments, and we talked to them about what the future looks like, an overdose epidemic, and what's working and what's not. And the continual conversation I have with both chiefs and patrol officers with 1 year service is, through the 70s and 80s, how did we do? How did we do with the same old arresting of drug users for a minuscule amount of heroin and locking them up for a couple of days? How did that work out? And everybody agrees it didn't work out all that well. So why not try something new? We owe it to, we talk about being progressive leaders, progressive police officers, and following the science is a big part of policing now, is evidence-based decision-making. So you start looking at that and you can quickly, I think, get convinced that at least try something different.
Hey, thanks for that, Conor. Hey, Bill, we got a question specifically for you. let me, oh, here it is. So you stated the pop-ups tents that in general are left alone, it's seen as a public health issue. The question is, but have there been issues with individual officers not leaving them alone? I know that always is a concern. We have a Good Samaritan law here in Ohio, but some officers not necessarily uniformed enforcement. Do you have any issues with that? You're on mute there, Bill. There you
Sorry.
go.
Yeah, no, we haven't had any issues with individual officers in these. They're so common now. I have to say that, they'll pop up and, if we have a tent city somewhere, they'll pop up in there and, our local health authority is pretty quick to go support them and get them what they need and that sort of thing. So we just leave them alone.
So it's more general wide that the officers are not, they know that this is something that they don't necessarily need to enforce that's being seen as a health issue?
Yeah, once again, if we go in and disrupt people from accessing these or shut them down, people are going to go use somewhere where they're at much higher risk to overdose and die. So, and that's well known throughout the department.
Okay. Hey, Bill and Connor, I think you both deal with insight, with the insight prevention sites. And this is something I've heard in the past too. And there's someone in California, the Narcotics Officers Association has been claiming that Insight is very unpopular with the business owners and residents of nearby Chinatown neighborhood because there is an increased crime and problems near Insight. Is this something you see there?
Once again, I think I said it earlier, Chief, is that Insight was placed into an area that had a high crime rate and high drug use rate. Those issues weren't created because of Insight. They were there before Insight.
Conor, you got any experiences with that?
Yeah, so we had a site here in Victoria that when it first opened, the sergeant of the team of beat officers that worked in the area, he came to me and he basically said, look, this place is a pain in my backside. It is, he goes, I think it's attracting some drug dealers that are hanging around 10, 20 feet away from the doorway. And it's an annoyance. And this is not what I hoped this site would be. So I got involved and we took a look at that particular situation. And it was clear that some of the things that we want to be in place weren't working as well as we hoped, which is that these sites, the sites we have here in Victoria, they need to be working very cooperatively with the police. The management needs to be in rigorous and constant communication with the police because their success will be guaranteed to a certain extent if they do not cause disruption to the community. And peril can come if they gather a lot of negative attention. But the management at this particular site, it was a wrong personality fit, and they didn't want to operate the way that the community needed them to operate. So everybody answers to somebody. And we went to this person's higher up in the health authority and we said, look, this relationship isn't working. And so with a management change, everything changed with that. The site needs to take responsibility for what goes on inside the facility, but also they have to have an awareness and responsibility for what happens outside the site, because if they don't want the police hanging around, they have to essentially police themselves to a certain extent. And that's what the new management brought in, was this responsibility for looking beyond their doorway into what was happening outside the site. And we've done this with similar locations throughout the city now. We've signed a cooperation agreement between the police department and the Overdose Prevention Site so that we will lay out the groundwork for what is their responsibilities, where we'll be, what our responsibilities are, and how the two will come together when we need to help each other, or how we'll stay out of each other's way when we can hinder each other's success. So I really, really encourage all police departments and anybody thinking about opening up one of these sites, make sure that you're talking and you really have to genuinely want to work together. It can't just be platitudes. You have to work together to save people's lives, and it has to be give and take on both sides. Nobody's going to get everything they want, but if there's a bit of negotiation and give and take, my experience is you can make them work.
It sounds like it's about building relationships, having that trust, and identifying where you're going to put a site in, and that constant communication. It sounds like that's really the key to it all.
It sure is, Chief. I mean, how many of all the problems we try to solve in society, communication is probably the number one thing you got to do right.
Right. Hey, Henrik, this is a question from the folks listening in. And all of you, I think, mentioned this, but how do clients of these sites feel about them being located near police departments? Has that come up to be a problem with people getting into the sites, or do some people avoid the sites because they're close to the police department? Henrik?
Yeah, it's a good question. No, they don't avoid it. Beforehand, they were actually very close to the police station. But so we know each other, and they know the police, and we know them, and whatever. So now it's a natural thing that they are close to the police station. That makes them feel safe. It's safe for the workers there, and again, relationship and dignity. We treat them with dignity as fellow citizens, and they're part of us. We belong to them. They belong to us. So I think it's good they're close.
Again, it's that relationship. If you have a police department looking at it as a health issue and looking to help, they're actually helping all parties. So that's fantastic. I'm going to combine the next question together a little bit. David, who's out here in Cincinnati, who's just having these conversations, is talking about stigma and how do you inform public policy, especially with the political realm and being concerned about stigma. But I'm going to mirror that with how is the public consulted on opening these prevention sites? You guys are kind of tapping into it. It sounds like you got to have a lot of conversations. There's conversations on stigma. There's conversations with the community. There's conversations on the political side of it, at least starting these out. Bill, you got some advice you can give folks with that?
Yeah, Chief, if I look kind of distracted, it's because I'm on 2 calls right now, and I'm actually listening to a city council meeting where the city council is debating opening another overdose prevention site.
You're really good at this, Bill.
I'm horrible at it. They're debating opening another overdose prevention site in an area of the city that is not, not normally where we would put these sort of things. So I will tell you that it's very important to consult everybody involved. I know that Conor and I sit on a number of committees where we deal with people who use drugs, or peers that we call them, healthcare, for other first responders, government officials. It's important that everybody talk these things out. And like Conor said, I can't stress enough about the communication, and the consultation is very important. Location, location, location. Sometimes it's very obvious where to put these things, and sometimes it's not. And if you put them where they're not needed, they're going to fail. And we don't want them to fail. We want them to succeed. We want them to save lives. So yeah, consultation should be as broad as possible. But in a lot of cases, it's very obvious where they need to go in a lot of cities, and you don't need the big insight storefront model. I would say that probably won't work in most cities. Where you would probably achieve most success and minimize things like stigma is if you put these sites inside of things like clinics. The Dr. Peter Center in Vancouver is a very good example of a site that's had a ton of success. And like I said, most people don't even know it's there.
That kind of segues into another question, Conor, from the viewers. Is there a relationship between these sites and treatment facilities? Is it just an overdose prevention site, or is there access to ongoing or continuum care?
Yeah, there is. Some of the sites, the pop-up sites that were brought in very quickly to just get a handle on the sheer number of overdose deaths. I mean, we're talking about, we had an 800% increase in overdose deaths in the course of 4 years. So these pop-up sites were designed just to keep people alive, basically to stop the hemorrhage bleeding of society. But the bigger sites have what we call wraparound services, which is that there are addiction counselors, and there are rehabilitation experts, and there are addiction specialists, physicians, accessible at the sites. And the idea is that at these sites, somebody who is dealing with a severe addiction, they can use in an alley and they'll never be able to access, they'll never have access to somebody who can help them. But if they use in one of these sites, every opportunity, every time they're using drugs, there is an opportunity to have a meaningful conversation. And eventually that one meaningful conversation will lead to 2 to 3, and they'll ideally access some rehabilitation treatment. So, and we have the numbers behind that where people go there to use, and then they go there to start to not use anymore.
Yeah, thanks, Connor. I think we can a little bit of background. We can make sure they're muted, please. And then, Henrik, I got another question. This is from a law enforcement officer. In these cities that you have these overdose prevention sites, are you guys still enforcing drug laws if the activity is actually outside these sites, Henrik?
Yes, we are. Short answer, but yes.
Yeah, no, that's
but not close by. But if it gets a problem, of course we're taking care of selling and whatever. Yeah.
Okay. And then this is from another police officer, and they're asking, there's often these peripheral crimes which may be helping to support that addiction, that many of us in law enforcement see, crimes like theft. Have you guys seen any change in these types of crimes near these sites? Have they gone up or have they gone down? Conor?
We've not seen any change in crime in the area around. As I mentioned, there was the one site that we felt there was some increase in drug dealing. We dealt with that really effectively. But as far as other collateral damage kind of crime, we haven't seen that.
Hey, Bill, have you guys seen anything like that?
Yeah, Chief, we've seen certain areas increase in kind of ancillary crime like theft from autos. But what I will say is, once again, we're operating on a model that was invented 20 years ago, and we need to progress past that. In British Columbia, like Conor mentioned earlier, now we have access to safe supply, but it's not as widespread as we'd like it to be right now. And, you know, when we give people a safe supply of drugs, it allows them to use something that's pharmaceutically produced, medically regulated, medically prescribed, and they don't have to go out and commit crime. They don't have to break into your car. They don't have to sell their body. And, you know, it's a win-win for everybody in society. So I think we have to progress beyond the model that we're using now and you know, really support safe supply going forward. I'll tell you that if you open up these sites in areas where there's no drug dealing, you're gonna have predators coming to the prey, right? Because you're telling these people, bring in your street drugs. So I would say, make sure as you're going forward, my advice would be to, you know, really fight for things like safe supply, and that'll take organized crime, drug dealers out of the mix.
Okay, we got 2 more questions, but I'm going to tailor this one. And Bill, someone's asking about how safe supply works. And Amos, I guess everyone's going to be able to get the contact information from our panelists. That might be a good one to actually reach out to Bill personally and ask. But there was a second part of that. And Bill, can you just answer this really quick? Who funds safe supply? Is it the government?
Yeah, the provincial government.
Okay. And then the last question, and I obviously this is a topic of great discussion and interest. And the last question is, and I'm going to leave it to all of you, have you responded or traveled to other police departments? This is obviously pre-COVID. We know COVID, you're not allowed to necessarily travel, but pre-COVID, or let's say there's a day where there's no more COVID, would you all be willing to travel and give your firsthand experience to communities and help them design these or get some discussion with this? Henrik?
Yeah, very much. Of course, we have to.
Conor?
Yes, Chief. You know, I look at this situation as you know, one thing I've enjoyed about a policing career is that in policing we have a brotherhood that we share with each other, and we want to share information to keep each other safe. and to grow our experiences and grow our professions and careers, etc. But that sentiment, I think, also wholly applies to the concept of keeping our cities healthy and safe across North America and across the globe now into Europe. So I personally feel very passionate about people getting to experience from those who have already been down a particular path. I think, Bill and I have worked together now for a good number of years, and we have so many experiences and so many stories, what went right and what went wrong. And while I don't normally use the word morality in any discussions about any of these topics, I feel like there is a morality, or I am morally obligated to share those experiences with people so that they can have the benefit of not making the mistakes we made, and seeing some of the right decisions that might work for their community. So happy to always share that information with anybody who wants it.
Okay, thanks. Hey, Bill, what about you? You willing to help out if someone needed it?
Yeah, Chief. I mean, I've traveled extensively throughout Canada, the United States, Europe. I've been to Portugal. I've seen what's happening in Portugal. I've been to Norway. I've been, to a lot of other countries and seen what's going on. And I think it's important that we share our knowledge. Like Conor said, tell people what's working, what's not working. And, that's how we solve these issues. We don't claim to know everything, but we can tell you our experiences and what's occurred. And I can say that, 10 years ago when I walked into the room, most people didn't believe I was a police officer when they heard what was coming out of my mouth on this topic. And that's why I love wearing my uniform, so people actually believe that I'm a policeman. So yeah, I'm happy to share, virtually or in person, anything just to progress this topic. I think no matter where we are in the world, we are all facing the same issues in policing. And one of these is drugs and addiction.
Yeah, fantastic. When they asked me to moderate this, I was thinking, yes, I get to go to Canada, I get to go to Denmark. And they said, remember COVID? And I was like, oh man, I sit on the internet and do it. Hey, this was a fantastic discussion. I told you this was going to be interesting, very insightful. I want to thank the panelists, a great group of people. Thank you for sharing your time. Thank you for sharing your knowledge. And I want to thank the audience for your participation and listening on this. Hey, Neil, I want to throw it back to you. Thanks for having me, and thanks for you guys helping to present this incredible discussion.
Yeah, Tom, thank you. Thanks again for moderating this. I knew it was going to be one of our best, if not the best, webinar that we've done with this great panel. Conor, Henrik, Bill, thanks a lot. Don't go anywhere yet, folks. I just have one more thing to let people know, so don't sign off. This March, I know it's scheduled for Philadelphia. And Tom, you just mentioned COVID, so we don't know what's going to happen. But I want folks to be a part of the 6th International Law Enforcement and Public Health Conference this coming March in 2021. Look at your screen. Kristen just put it up on the screen for us. There's the website. Go to the website at LEP2021Philadelphia.com. And we'd like to have you to, everyone on this, be a part of it, pass it on to other folks who are interested in topics like this and others, and hope to see you there. Again, thank you, Tom, Conor, Bill, Henrik. Thanks a lot for taking time to be a part of this important discussion. And thanks to everyone who has attended this. And as it's been mentioned, the recording will be sent out. It will be made available to you. So please share it far and wide with folks. This is a very, very important topic, and obviously the next step for many of us, mainly here in the United States. We've got to get this moving. So, and Amos, I want to thank Amos. All the folks behind the scenes, I want to thank Amos for a great job as usual. Darby, thank you, Darby. Kristen, I know you're around there somewhere doing things. So thanks to the wonderful staff at LEAP for making this happen. Thank you.